A user named Sarah sent us a message about wanting to learn more about anti-parasite medications, so that will be the topic of today's discussion. If you have topics you want us to focus on next or donate to our video and game development, reach out to us at doggersgame or dogtoursgame@gmail.com. Today, we are discussing parasite medications in 5 major veterinary species: dogs, cats, horses, cattle, and swine. The dosages mentioned are labeled examples for educational purposes. Actual treatment must be selected by a veterinarian using the animal's accurate weight, age, health status, pregnancy status, parasite test results, local resistance patterns, and, especially in food animals, meat and milk withdrawal requirements. Before discussing the medications, let's explain terms such as L1, L2, L3, L4, and L5. The letter L means larval stage, while the number identifies the parasite's developmental stage. L1 is the first stage larva, followed by L2, L3, L4, and L5. In many nematodes, L3 is the infective stage that enters the animal, L4 is a developing tissue or intestinal stage, and L5 is often considered the immature adult stage. The exact location and importance of each stage vary among parasite species. Starting with dogs, one commonly used brand is Heartgard Plus, which contains ivermectin and Pyrantel Pamoate. It is administered orally once every month at a minimum dose of 6 micrograms of ivermectin per kilogram and 5 milligrams of Pyrantel per kilogram. The manufacturer provides weight-specific chewables, so owners should give the complete chewable assigned to the dog's weight range rather than attempting to divide or calculate the medication themselves. Heartgard prevents disease caused by the heartworm Dirofilaria immitis. Adult female heartworms living in an infected dog produce first-stage larvae called microfilariae, which are essentially the L1 stage. A mosquito ingests those microfilariae while taking a blood meal. Inside the mosquito, they develop through L2 and become infective L3 larvae. When that mosquito bites another dog, the L3 larvae enter through the bite wound and begin developing into L4 larvae in the dog's tissues. The L4 larvae eventually molt into L5 immature adults, enter the circulation, and travel toward the pulmonary arteries, where they mature into adult heartworms. This entire process from infection to adult reproduction takes approximately 6 to 7 months. Ivermectin prevents heartworm disease by acting against susceptible tissue stage larvae before they become adult worms. As a macrocyclic lactone, ivermectin activates glutamate-gated chloride channels in susceptible nematodes. This increases chloride movement into nerve and muscle cells, interferes with normal nerve transmission, and produces paralysis and death of the larvae. Monthly heartworm prevention works as a reach-back treatment. The dog can still be bitten by an infected mosquito, and Heartgard does not repel that mosquito. Instead, the medication eliminates susceptible larvae acquired during approximately the previous month, before they develop into later juvenile and adult stages. This is why missing or delaying doses creates a problem. The larvae continue maturing and become progressively less susceptible to a routine preventive dose. Heartgard is not intended to kill established adult heartworms. A dog with adult heartworms requires testing, disease staging, exercise restriction, and a veterinarian-directed adulticide protocol. Dogs should therefore receive the medication on schedule throughout the year and should still undergo annual heartworm antigen and microfilaria testing. The Pyrantel in Heartgard Plus has a different job. Pyrantel activates nicotinic acetylcholine receptors in susceptible intestinal nematodes, producing sustained muscle contraction and paralysis. It treats and controls intestinal roundworms and hookworms, including Toxocara canis, Toxoscaris leonina, Ancylostoma caninum, Ancylostoma brasiliensis, and Uncinnaria stenocephala. It removes susceptible worms inside the dog, but it does not disinfect the yard or destroy parasite eggs that have already been passed in feces. Prompt feces removal remains important. For cats, a useful example is Revolution Plus, containing selamectin and seralaner. It is applied topically once monthly at a minimum dose of 6 mg of selamectin per kilogram and 1 mg of seralaner per kilogram. The complete weight-specific tube is applied directly to the skin in cats at least 8 weeks old and weighing at least 2.8 pounds. Selamectin is the ingredient that prevents feline heartworm disease. After an infected mosquito deposits Dirofilaria mitis L3 larvae, selamectin interferes with chloride channel conductance in susceptible larvae, disrupting nerve and muscle activity and causing paralysis or death. Like ivermectin in dogs, it stops the infection during vulnerable larval development rather than preventing the mosquito bite or reliably killing established adult worms. One labeled dose was shown to prevent heartworm development when given 30 days after cats were exposed to infective larvae. Heartworm prevention is especially important in cats because there is no FDA-approved medication for eliminating adult feline heartworms. Cats also may develop severe heartworm-associated respiratory disease even when only 1 or 2 worms survive. Revolution Plus additionally treats Toxocara cati roundworms, Ancylostoma tubiform hookworms, and Otodex cynotus ear mites. Serolaner blocks GABA and glutamate-gated chloride channels in fleas and ticks, producing excessive nervous stimulation and death. By killing infected fleas before cats ingest them, the product also helps prevent the flea-transmitted tapeworm Dipylidium caninum, although it is not a direct treatment for an adult tapeworm already living inside the cat. For horses, parasite control should not mean automatically rotating dewormers every 6 or 8 weeks. Modern programs use fecal egg counts, annual fecal egg count reduction testing, the horse's age, and the regional transmission season. One brand example is Quest Plus, containing moxidectin and praziquantel. Its labeled single oral dose is 0.4 mg of moxidectin per kilogram and 2.5 mg of praziquantel per kilogram for horses and ponies at least 6 months old. The syringe is adjusted according to body weight. Moxidectin interferes with chloride channel-mediated neurotransmission, resulting in parasite paralysis and elimination. Praziquantel alters calcium movement across tapeworm membranes, causing severe contraction, paralysis, detachment from the intestinal wall, and elimination. Quest Plus treats adult large strongyles such as Strongylus vulgaris and its L4 and L5 arterial stages. It also treats adult small strongyles, lumen-dwelling larvae, late L3 and L4 encysted cyathostome larvae, adult Anoplocephala perfoliata tapeworms, and second or third stage Gasterophilus spot larvae. However, no equine dewormer eliminates every stage of every parasite, and the medication does not destroy eggs already present in stalls or pastures. For a healthy mature horse in a temperate region, the first baseline macrocyclic lactone treatment is often placed in the fall. This helps target large strongyles and bots. If the horse has grazed green pasture, praziquantel is commonly included during the second half of the year, often in late fall after cold weather has ended most tapeworm transmission. A second baseline treatment may be placed during the active strongyle transmission season, commonly in spring or early summer, depending on the local climate. Additional treatments should not be automatic. Adult horses producing more than approximately 500 strongyle eggs per gram are considered high shedders and may require 1 or 2 additional treatments during the active transmission season. Low shedders usually do not require the same frequency. Fecal egg count reduction testing should also be performed to determine whether the selected product still works on that farm. For cattle, one example is Epronexporon, containing eprinomectin. The labeled dosage is 500 micrograms per kilogram, which equals 1 milliliter for every 10 kilograms, or 22 pounds, of body weight. It is applied topically in a narrow strip along the back line from the withers to the tail head. Eprinomectin is a macrocyclic lactone that disrupts chloride-controlled nerve and muscle signaling in susceptible parasites, causing paralysis and death. Its label includes adult and L4 Hemonchus placei, adult and L4 Ostertagia ostertagii, including inhibited L4 larvae, several Coperia species, adult and L4 Dictyocolus viviparous lungworms, and all parasitic stages of the cattle grubs Hypoderma lineatum and Hypoderma bovis. It also controls certain lice, mites, and horned flies. It does not destroy worm eggs or free-living larvae already contaminating manure and pasture. In temperate grazing systems, spring turnout is an important decision point because cattle begin ingesting infective pasture larvae. Depending on the farm's history and veterinary testing, treatment may be timed at turnout, or several weeks later, after parasites have been acquired but before large numbers mature and begin producing eggs. Another strategic point is the end of the grazing season, when treatment can reduce worms carried into winter. These should be targeted decisions based on age, production performance, fecal testing, and resistance, not an instruction to treat every animal on the same fixed date. Cattle grub treatment requires special timing. Cattle should generally be treated soon after heel fly season ends. Killing Hypoderma lineatum while larvae are in tissue surrounding the esophagus can contribute to bloat, while killing Hypoderma bovis while larvae are near the vertebral canal may cause staggering or paralysis. Regional timing must therefore be established with the herd veterinarian. When Epronexporon is used according to its label, no slaughter withdrawal period or milk discard time is required, but it must not be used in calves intended for veal. Finally, swine parasite control is generally timed around production stage, housing, sanitation, and pasture exposure rather than simply spring and fall. One product is Safeguard Aquasol, containing fenbendazole. It is administered through drinking water at 2.2 mg per kilogram of body weight per day for 3 consecutive days. It is not labeled for nursing piglets. Fenbendazole is a benzimidazole. It binds parasite tubulin and disrupts microtubule formation. Without functioning microtubules, susceptible worms cannot properly transport nutrients, maintain normal cellular functions, or produce energy, eventually resulting in their death. The swine label includes adult Metastrongylus aupri and Metastrongylus pudenditectus lungworms, adult and migrating L3 and L4 ascaris some roundworms in the liver, lungs, and intestine, adult Esophagostomum nodular worms, adult Hyostrongylus rubidus stomach worms, L2, L3, L4, and adult Trichuris sui whipworms, and larval and adult Stephanuris dentatus kidney worms. It does not destroy the highly durable Ascaris or Trichuris sui eggs already present in soil, bedding, or pens. In breeding herds with a documented parasite risk, sows may be treated before entering the farrowing facility, commonly approximately 1 to 3 weeks before farrowing, according to the farm veterinarian's protocol. The sows should also be washed and moved into a thoroughly cleaned farrowing area. This reduces the number of parasite eggs and larvae introduced to newborn piglets. Outdoor pigs need particularly careful manure removal, pasture rotation, and testing because they have more contact with contaminated soil and intermediate hosts. Swine treated with Safeguard Aquasol must not be slaughtered within 2 days after the final treatment. The most important lesson is that the word, dewormer, does not mean that a medication kills every parasite, every larval stage, and every egg. Heartworm preventives mainly act against developing larvae. Some horse, cattle, and swine products kill specific migrating or encysted larvae, while others primarily remove adults. Environmental eggs may remain infectious long after the animal has been treated. Successful parasite control combines the correct medication and dose with diagnostic testing, accurate weight measurements, sanitation, feces and manure removal, pasture management, mosquito and flea control, proper seasonal timing, withdrawal compliance, and monitoring for drug resistance.